If our vision is right, God will give you right people to work with and we can achieve our vision.
You are listening Nursing Leaders Opinion, crafted by Nursing News India. Today we are going to talk with Manju Dhandapani, who is a nursing leader in neurology domain. Hello Dr. Manju, welcome to the show by Nursing News India.
Thank you so much.
First of all, congratulations for being selected in 100 plus outstanding nurses and midwife leaders.
Thank you. Thank you so much. It's all by God's grace.
Please tell us about you and your journey in nursing career and how you choose to become a nurse and motivation behind it.
If you ask about me, I would say that I'm a nurse. I'm really proud to say that I'm a nurse. If you ask about my motivation to join nursing, my elder sister was a nurse. So other than that, I do not have any specific motivation. So like any other students, after my plus two, I also did my competitive exams. And I was selected for BSc Nursing in AIMS, PGI, and some other institutes. Of course, I chose to join All India Institute of Medical Sciences, New Delhi, where I got the best teachers, best learning facilities, and learning opportunities. So I completed my BSc Nursing in 2000. And after that, 4 years, I was working as a bedside nurse in neurosurgery critical care unit. It was really a good experience. It was a turning point in my personal as well as my professional life. Personal, because that's the place where I met my better half, who is a neurosurgeon, additional professor in PGA in neurosurgery. And now we are parents of 2 lovely kids. Why professionally? In nursing, we learn many things. So when I was working as a bedside nurse, I did everything best for my patients. Based on whatever I have learned a lot of nursing skills during my posting in that critical care unit. But one thing I realized that patients who are admitted with neurological and neurosurgical illnesses are having a lot of unmet needs. Not only the patients, but their caregivers too. So nurses are the one who is really touching their hearts, and we have a lot to do for them. And I believe that we are the backbone of nursing. So anyway, after 4 years, God gave me opportunity to do my master's in neuroscience nursing, and where I got equipped myself through my teachers, through my research experience, and even with my husband's support, I got equipped so that I can do something better to meet those unmet needs of the patients. So after that, when I was doing my PhD, I can say that I was experimenting how and what I can do for those patients. And after completing my PhD, since then, I started doing something differently to meet those needs of the patients. So if you ask about my experience, I have like 20 years of experience, including my teaching, clinical, as well as research experience. So this is about myself in brief, I can say.
You told that nurses are the backbone of the healthcare system. What is your view on this and how can we enhance the contribution of nurses?
Yeah, I believe that nurses are the backbone of the healthcare system. So because you know that nurses are the major workforce in the healthcare system. And in India, we have more than 3 million nurses. Though out of their lot of struggles of poor salary and poor working condition, they do best for the nurses. And not only in terms of work, the magnitude, in terms of the time that we spend, the nurses spend the maximum time with the patients. So if you see, we can rightly say that nurses are the backbone of the healthcare system. So they are doing best for the patients based on their learning. So still, I believe that they can even do better, because if we look at the positive clinical outcome of the patient, if you always look at the outcome of the patient, how they can be, how we can make them like they were before they were getting the disease conditions, we can do much more than just what we have learned. We can, through our research and through our innovations and evidence-based practices, a lot of evidences, a lot of researches are going on, a lot of new evidences are coming up to serve the patients in various aspects. So in that terms, if we see, nurses can acquire those skills through their research and experiments, and we can do that for the patients, and we can really improve the patient's outcome. Because nurses are given the opportunity to serve the mankind, and I personally believe that human beings are the creatures who are being made in the image of God, and we are given the opportunity to serve them. So it's a proud privilege, really. So, other than this clinical bedside nursing, we can also see that in teaching or in leadership or even in policy making and in community level, nurses can do much, much more contributions which can enhance the healthcare outcome of our country. Nurses are also having specialized courses, like advanced courses in various specializations. Like nowadays, we have masters in cardiovascular nursing, neuroscience nursing, pediatric nursing, community health nursing. So through the specialized roles, nurses can contribute much more towards the patients and their outcome. Actually, when like that in medicine side, the specialized doctors are serving the patient, similarly treating the patient. Similarly, when the nurses are specialized in their own field, they can give much more holistic and comprehensive care to the patients who are suffering from complex illnesses.
Can you tell about some of your career milestone as a nurse and any professional achievements?
I can say that being a nurse itself is a milestone for me now. If I remember, when I was working as a clinical nurse at bedside, I can say that every day for me was a milestone, because I felt that I used to improve upon my work every day by day. That is the time I really understood why nursing has been defined as an art and science. I always used to think why nursing is being defined, this definition of nursing is being started as nursing is an art. So when I was working at the bedside with my patients, I understood that every day we can do better for our patients. Every day we can reach out better to the patient and provide better care to the patient, like an artist who improves upon his or her work every day. So that I can say that I felt that every day is a milestone for me during that period. After that, if you ask, like, I had the opportunity to do masters in neuroscience nursing when it was first established in India from All India Institute of Medical Sciences, New Delhi. And my PhD, my doctorate degree, it was an exhaustive work which I have done on the patients of neurosurgery with brain tumor and their caregivers, which got a lot of appreciation. And I got the opportunity to work in premier institutes like AIMS, JIPMA, Pondicherry, and PGI. And other than that, I have got many times, a few times I've got best paper award for my scientific paper presentation. And in 2012, I was selected by Society of Indian Neuroscience Nurses as the best PG neuro nurse. And other than that, I have got a couple of times grant from UGC and Neurotrauma Society of India and University of Central Florida College. They had approved my scientific paper and given me grant for attending international conferences. And I also felt very happy when my papers got accepted for international conferences which were held in Boston, Florida, Colombo, Tel Aviv, and Birmingham. It was a great opportunity where I could collaborate and had networking with international counterparts. And another thing that I remember in my career is that, like, I was invited as a guest a speaker by Hamad Medical Corporation, Doha, as a guest speaker for deliberating on stroke nursing. So these are some of my milestones or some of small achievements which I can talk about. And I was also in 2013 was elected as Secretary of Society of Indian Neuroscience Nurses. So that's about my small achievements, if I can remember.
You told that neuro nursing is your specialty and passion. Can you tell about the significant role of neuro nurses in patient care and any contribution from your side?
Yeah, that's a very good question. So, many of the neuro patients who are having neurological or neurosurgical problems like brain tumors, stroke, and head injury and spinal cord injury, many of the patients are totally dependent. They are sometimes they are unconscious, they are bedridden, so they need complex nursing care. They have not only physical problems, they have pain, suffering, psychological, emotional, behavioral problems, which all result a huge burden on caregivers and result in caregiver burden. So and also these patients need to continue with a lot of rehabilitative home based rehabilitative activities or hospital based rehabilitative activities for their recovery. So nurses have a great role in their clinical outcome, so there's no doubt about it. And the skill nurses need to possess also is complex. So we have to be really competent. The neuro nurses have to be really competent to daily provide care to the patients who are having neurological and neuropsychological problems, neurosurgical problems. So I got the opportunity to do my neuro nursing, and since that time, I had real passion to serve these patients and improve their whatever small things which I can do. I should be able to do. I told you that when I was doing my masters, I got a lot of ideas. How can we help? What? How can we do little small different things to improve their outcome? So when I was doing my PhD, my guide, if I remember, Dr. Sandhya Gupta, and my mentor, Dr. Manju Valsa, they really guided me well. And so that after completing my doctorate, how I can implement based on the findings that we had during my doctorate degree. Like we did an experiment, my research on caregiver burden and patients behavioral problems, and we came to know that a lot of problems are there for the patients, emotional and behavioral problems are there for the patients, which affect the caregivers. So we really searched more evidences, and we understood that nurse-led interventions, nurse-led counseling can help these patients and caregivers. So in our institute, what we did was like we have just has developed a structured counseling program for these patients and the caregivers, and we trained the nurses and a neuro nurse to be a counselor, and we started a nurse-led clinic over here where we attend the patients and the caregiver who are following up here in PGA, and we are identifying their problems, behavioral problems, and the patient's caregiver burden, and based on that we are able to provide counseling to them. So it is I feel really satisfied. It's a teamwork. It's nothing from my side alone. It's a teamwork from the neurosurgery department, nursing department, and I really thank everyone for helping me to do that initiative successfully, which is really beneficial for the patients and the caregivers. And other than that, we are also doing on the stroke day, and also for the stroke patients, we are doing a lot of activities, community level, school level activities we are doing, and we are doing stroke support groups. We have initiated stroke support group in India. This is the first time in PGA we have initiated. We have conducted 2-3 support groups where the patients and the caregivers of the stroke will be joining together, and we will be giving them education, and we will encourage them also to share their experience, because because they are the actual sufferers. We are not the sufferers, they are the sufferers. So when they empower each other by sharing their experience, how they are overcoming various struggles that they have, the other patients and the caregivers get motivated and really get an energy and positivity to go ahead in their life. So other than that, also we are developing some stroke guidelines, and we are often organizing conferences in our institute. And we are also, like, after initiating this nurse-led clinic in neurosurgery, we are also I'm also been a part of initiating amputation clinic in PGA, because we know that patients of amputation also suffering from a lot of problems. So what I feel that as a nurse, like if our vision is right, we can do many things. So our vision gives us power. Our vision is power. So we don't need a special position, or we don't need so much money, or we don't need so much knowledge to do something differently. But if our vision is right, God will give you right people to work with, and we can achieve our vision. That is my small work that we do for the patients over here.
What is the focus of Society of Indian Neuroscience Nurses and your collaborations?
Yeah, I've been serving Society of Indian Neuroscience Nurses as a secretary since 6 years. So this society is a 41 years old society now. It's one of the pioneer nursing society in India. So our main motto is to reach out to the patients through empowered neuro nurses. So our main motto is to empowering the neuro nurses. We organize annual conferences. We encourage the nurses to do research and present their papers and contribute. And we are also focusing on developing various guidelines. Like we have developed the guidelines for the stroke nursing management in India. And so we also organize various workshops in collaboration with various societies like Neurological Society of India and SIMIPS, one of the endoscopic society of India. And we also have some international collaborations where we have tie-up and we organize various educational activities. And now shortly we are going to start a short certificate course on stroke nursing, so that we can equip the nurses in the acute management of the stroke, acute and ongoing management of the stroke. We are having tie-up with ECHO platform, and we would be starting it soon.
Can you discuss about your research interests?
Yeah, as I already told, my main passion is neuroscience nursing. So my research interest, my major work is on brain tumor. Other than that, I have worked in stroke and brain injury, traumatic brain injury. And other than neuro, we also focus. I also love to work on nurses and improve the welfare of the nurses. In collaboration with Trained Nurses of Association of India, we would be soon taking up a project on improving the healthcare strategies to prevent cardiovascular and cerebrovascular disease among nurses. For that, we need to know how much is the prevalence of the various factors in nurses. So we will be trying to identify that through a project and tie up with Trained Nurses Association of India. I also work on palliative care with Dr. Gopichandran. We have developed a mobile application for palliative care of the patients who are terminally ill to enhance their medication compliance. So these are the main focus. Other than that, whatever comes along. So now when the COVID came, we have done some of the work in COVID as well.
Can you throw some light on the contributions you have made during COVID 19?
Yeah, so it was a real challenge for everyone. I hope for you also it was a challenge. So during this COVID pandemic, we have, though it was challenging, we have explored new ways of managing new normal life. So, in our educational activities, if we see, like it was badly affected in the very initial few days, but we quickly tied up with various online platforms, and we could conduct our exams well. And we also could conduct the examination of students through OSCE and Osler. We could conduct their exams and even we could start the next academic year in our institute as a teamwork. We could do all these things. And other than that, if you ask specifically to COVID, like in our institute, we have our institute we have developed a system of safety, physical safety, and to enhance the mental health of the caregivers. We have developed a system of surveillance or of directly monitoring the healthcare workers while donning and doffing personal protective equipments, PPEs. So we were a part of that team, and we are a part of the surveillance team. And so it is through basically a real time remote access audio visual aids we are doing it. So we are sitting a far apart place in a control room, and we are monitoring the nurses and the other healthcare workers while doping, and we are guiding them. So our institute is a part of that, and has innovated this particular intervention. We are just a part of that team. And other than that, I have, along with my team, initiated a scoping review on critical care management of patients with COVID. So it is going to be published like in dimensions of critical care nursing soon. And other than that, we have worked on mental health nurses experience in like how the COVID nursing is different from a routine nursing, and what all challenges they are facing, and various strategies various countries have adopted. We have analyzed on that too. So these are the different works, some of the, and we have also analyzed what are the various challenges developing countries like India can face in COVID as well as in non-COVID areas. So these, some of our work are under publication and some are already published. So that's it.
How did you feel when you came to know that you are selected among the 100 nursing professionals in the global platform by Women in Global Health team to celebrate the year of nurse and midwife?
First of all, I would like to thank Women in Global Health and their partners, WHO, ICN, ICM, and Nursing Now, and UNPFA, for recognizing me among the top 100 in a global platform. So it was a real surprise, because I remember one of my counterpart, Mr. Suresh from Safdarjung Hospital, Delhi, nominated me. So when he asked to nominate, I gave my CV to him. But after that, I never expected that I would be selected, because I knew that, especially when I saw the list, I was wondering, because many seniors and many experts in the nursing field of nursing from the global platform, I myself thought where I am standing, what I have done for the nursing to be selected among these. Maybe somehow God would have made them to be pleased with my profile that I had, what based on the small works which I did. That's all I can say. And when the result was announced, to be frankly speaking, I was on a telephonic conversation with my student who was facing certain problem in her thesis. So I was getting multiple calls when I was attending that conversation, but I did not attend any of them. But when I got a call from Mr. Suresh, I guessed there was something. And as soon as I finished my conversation, I called him back. He told, "Madam, please check your mail." And then he did not that I'm selected again. So when I checked my mail, I was really astonished, and it was a real great feeling, because I myself was not understanding what I have done so differently. Maybe as I told you, I was sincere in my work, I was honest in my work, and it is not me exactly who received this recognition. It is my team, or it is this, because I can say that I myself do not exist. I am a part of a system. And so, behalf of the system, I am just receiving this. That's all. I'm really happy, and I really thank God. What I can say is that if we continue our right work in right time, God will definitely reward us. Nothing will go unrewarded if we do our right work. As I already told, if we have the right vision, God will give us the right people to work, and nothing but our vision is our power. So continue your good work. And this is what I want to say every little nurses who belong to my profession. Thank you.
Thank you very much, Dr. Manju, for giving your time, thoughts, and great insight about the nursing and your achievements.